looks something like this. It has 6 factors, which include surface area, depth, amount of exudates, drainage, tissue type, and color. So for every category, we give or we assign certain scores. Say for example, the surface area of one bed sore is 0.3 square centimeters, then we assign 2 as the score of the bed sore. For the depth, it can be no depth, partial thickness, which means the wound extends into the epidermis and to the dermis, but not through the dermis, while full thickness, which has a score of 2, means that the wound extends into the dermis, which may expose some adipose tissue, muscles, and others. The amount of exudates can be no exudates, light amount, moderate amount, or heavy amount. Drainage means it characterizes the amount or the exudates that are present in the bed sore. It can be no drainage. Serous, which means there is a thin or clear discharge. Sanguineous, which means there is fresh blood. Serosanguineous, which means it is pink to light red discharge. And purulent, which can be creamy yellow or pus-containing discharge. For the tissue type, it may be closed. Epithelial, which means new or pink shiny tissue. Granulation tissue, slough of tissue, and necrotic tissue. For the color, it can be normal, red, yellow, or black. Silver sulfadiazine here in our study is our control. Silver sulfadiazine is an antibiotic cream which is primarily used in prevention and treatment of infection in bed sores as well as in burns. Aloe vera here in our study refers to the aloe vera gel collected from the aloe vera plant, and it has anti-inflammatory and antibacterial effects which may promote wound healing.
For the conceptual framework, aloe vera serves as our intervention for improving moderate to mild type of bed sores. And as mentioned, these are the factors that would determine whether healing takes place: surface area, depth, exudates amount, drainage, tissue type, and wound color. As for our problem statement, this study will answer the problem: what is the potential of using aloe vera as a substitute for silver sulfadiazine in treating bed sores? The hypothesis of our study is that aloe vera is a potential treatment for improving moderate bed sores to mild bed sores. For our objectives in conducting this study, the researchers specifically aim to describe the bed sores of the patient prior to the treatment based on the bed sore assessment score. Second, describe the bed sores after 7 days of treatment with silver sulfadiazine and aloe vera based on the bed sore assessment score. And lastly is to compare the bed sores treated with silver sulfadiazine and aloe vera based on the bed sore assessment score. What we did was we recruited a participant and explained all the guidelines and precautions to the participant as well as to the institution. After that, we gave out informed consent and started performing the experiment. 2 bed sores are involved. I will assign bed sore 1, the control, and treated with silver sulfadiazine, while bed sore 2 is treated with aloe vera. The 2 bed sores will be assessed through the already said factors. The experience started with the researchers assuring a septic technique. Before applying the treatment, we flushed the bed sores with plain normal saline solution and we applied the treatment. For bed sore 1, it was simply applying silver sulfadiazine using sterile gauze since it is readily available in tubes. As for the aloe vera, we first flushed the aloe vera leaf with plain NSS and used a sterile blade to cut the leaf, and then we collected the aloe vera gel with the sterile gauze and further applied it to the bed sore. After applying treatment, we covered both bed sores with a sterile gauze to which we applied the treatment as well. And then we secured it with non-woven gauze and micropore tapes.
For the results and discussion, these are the photos of the two bed sores that we treated. Bed sore 1, which is treated with silver sulfadiazine, our control, and bed sore 2, which was treated with aloe vera. These are the results. It shows that bed sore 1 treated with silver sulfadiazine, and by the way, bed sore 1 is located on the lumbar area. Prior to intervention, the patient's bed sore measured 3 square centimeters, so it is scored 5. While bed sore 2 measures 2 square centimeters and it has a score of 4. For the depth, both are of partial thickness wound, so they both score 1. While for the exudates, only bed sore 2 has exudates. And so for the drainage, only bed sore 2 has drainage, which is sanguineous, which means it has fresh blood. For the tissue type, both are of granulation tissue, and for the wound color, both are of red wounds. So for the total, bed sore 1 has a total of 9, while bed sore 2 has a total of 11. These are now the photos of the bed sores after the treatment. And these are the results. From 3 square centimeters, bed sore 1 now measures 1.5 square centimeters, which gives it now a score of 4. While bed sore 2, from 2 square centimeters, now measures 1.5 square centimeters, and it will now be given a score of 4. For the depth, both maintain their depth and still are of partial thickness. For the exudates, bed sore 1 did not develop any exudates nor drainage, while bed sore 2, the exudates were no longer present. For the tissue type, both improved from granulation to epithelial tissue, which now gives both the score of 1. And for the wound color, both bed sores maintained red wounds. The total score now of bed sore 1 is 7, and the total score of bed sore 2 is 7 as well. These are the photos of bed sore 1 treated with silver sulfadiazine prior and after 7 days of treatment. That's just a closer look. And these are the photos of bed sore 2 prior and after the treatment. And another closer look. This is just to show the points improved by both bed sores. So bed sore 1 improved by 2 points from 9 to 7, and bed sore 2 improved from 11 to 7, making that 4 points. We therefore conclude that aloe vera is a potential treatment for bed sores, which validates past experiments on aloe vera and silver sulfadiazine. We are able to say so because aloe vera was able to decrease the surface area of the bed sore. It was able to improve the tissue type of the bed sore, maintain its depth, and it prevented the bed sore from becoming severe in terms of wound color. And aside from that, it can eliminate the presence of exudates and drainage.
For the recommendation, the researchers recommend that aloe vera be explored as a standard treatment for bed sores. As this study was suggested, the potential effectivity of aloe vera in treating bed sores, the researchers recommend that there be further studies conducted to prove the effects of aloe vera. Third, the researchers recommend that aloe vera be looked into possibility of being included in the 10 herbal meds approved by the DOH because it has many uses and it's effective on wounds and bed sores, as this research suggests. Fourth, with the positive results of this study as basis for this recommendation, the researchers suggest that there be a topical cream preparation for aloe vera. And lastly, the researchers recommend that if possible, every family plant aloe vera in their backyard. Because aloe vera has many potential uses, this will help improve the accessibility of aloe vera. And that ends our presentation. Thank you.
Okay, thank you very much. Any question from the audience? I thought aloe vera is only for hair loss. It's also used for bed sores. Yes, madam.